Well, keeping on the theme of national programs addressing dietary needs of older populations, we've got two presenters next. One presenter, Lura Barber, Director of the Hunger Initiatives. We heard from National Council on Aging. We'll talk about USDA nutrition programs for the older population, including participation in SNAP and outreach initiatives. Those are topics, obviously, that have been addressed so far, so I know that we're looking forward to that content. And also joining her is Catherine Law, who's with USDA's Food and Nutrition Service, to talk about the same topic.
Thank you, Robert, and thank you everybody for being here and sticking around through the afternoon sessions. I think today has just been completely fascinating from start to finish. And I have to say, Dr. Yen's research about the built environment, I found personally, I'm personally worried because there's a wine store and a Chipotle opening across the street from my apartment building next month. And I feel like my risk factors are not good right now. So if somebody could do some research about guacamole proximity and its effects on health, I could use that. So my name is Lura Barber. I work for the National Council on Aging. We are a service and advocacy organization based here in Washington, D.C. Our mission is to improve the lives of millions of older adults, especially those who are struggling. And so we're looking at adults in the community, 60 and older, at or below 250% of the federal poverty line. We work in healthy aging with programs like chronic disease self-management and falls prevention and in economic security, which is a lot of what I'll be talking about today. And we do our work in partnership with a national network of organizations, not just in the aging network, but in other fields as well. So I'm going to be talking a lot today about the first year and some of the results from the second year of a senior SNAP enrollment initiative that grew out of our work in benefits access with some grants from the Administration for Community Living initially, and now with Walmart Foundation. So we've heard a lot from passionate speakers about the food insecurity that seniors are facing today. We know that 5.4 million seniors are struggling with food insecurity. That's leaving aside those who are experiencing the threat of food insecurity, which we know has effects on activities of daily living, as Craig pointed out earlier. But I think it's useful to step back and look at food insecurity in the context of the economic security of seniors. So here are some facts that I think are pretty staggering. The annual Social Security retirement benefit today is about $16,000 a year. How far does that go? Not far, especially when you consider that the average out-of-pocket medical expenses for Medicare recipients is about $3,300. Add to that the fact that 22% of married couples and about half of unmarried persons are relying on that for 90% or more of their income. And we've got this debt epidemic where of those 60-plus households that have debt, the median debt is almost $41,000. It's not a pretty picture. And so even though I'm going to be talking about how we address senior hunger with SNAP, I think it's good to think about SNAP like the back of the cereal boxes used to be, where it would say Cheerios is part of this complete breakfast. And then it would have Cheerios and milk and a glass of orange juice and 2 pieces of toast and like a spiral cut ham and all these things like a Henry VIII style breakfast. Because we can't just give people dry cereal and say, here you go, make the best of that. You really have to look at the big picture. And I think this speaks to, when we're talking about balanced nutrition, we also have to have a balanced approach to this food security question. So we have benefit programs for older adults, for Medicare beneficiaries, that I think act as a food benefit because you're putting money back into people's pockets and you're saving them money. So you've got SNAP, of course, so maybe that's the cereal. You've got Medicare savings programs. At a minimum, that's going to put the Part B premium back in someone's pocket to the tune of about $100 a month. So maybe that's the orange juice. Part D low-income subsidy is going to be the toast. That's going to cover the costs, out-of-pocket costs associated with your prescriptions. You've got your LIHEAP and Medicaid, so maybe your side of bacon and some milk. And that's a full meal. And that is what we preach and preach and preach, and what we have worked on with our benefits enrollment centers through grants from the Administration for Community Living to develop this holistic approach. Because when you're thinking about this median benefit of $16,000 a year, if you're wrapping around benefits access and you're making it holistic and person-centered, you're significantly increasing the value of any single interaction and any single encounter with a senior who is accessing SNAP. So say they come to you for SNAP as a community-based organization, and you have a chance to talk to them about how they can save money on their medical care. So we've seen this over the past few years, a rise in interest among our network in SNAP, and then sort of the corollary on the food security side, folks who've been working on SNAP for a while getting more interested in working with seniors. So what does SNAP look like for seniors? Just some quick facts. The median SNAP benefit for households with an elderly person is about $134. It's a little bit less if you live alone. The participation rate right now is about 42%, and that's a lot lower than other households that are also eligible. So there's been some research about why that's so low, and Catherine Law from USDA is going to talk about some of those. About 15% of the elderly SNAP households do receive that minimum benefit, which is now $15, and the average household size is pretty small. It's about 1.3 people. So our goal is to close that SNAP participation gap. So I'm going to share some of the best practices that we saw in the first year of our Senior SNAP Enrollment Initiative, and it clusters around 3 areas: community-based assistance, reaching consumers online through social media, and then some policy work. So community-based assistance. So we've been working on the Senior SNAP Enrollment Initiative in the field since March of 2014. In the first year of funding, we worked with 37 community-based organizations, re-granting $1 million. Right now, we're working with 32 groups, and we re-granted $1.15 million. So since the start of the initiative, we've helped almost 200,000 seniors screen for SNAP and other benefits by taking that holistic approach. Our partners have submitted almost 47,000 SNAP applications on behalf of older adults, and this is all over the country. And the estimated value of those applications based on general acceptance rates and the value of benefits is about $64 million. And we anticipate probably submitting another 15,000 SNAP applications before the grant ends. So we've been really successful. We've exceeded the goals for the grant, and we've learned a lot in the process. One of the things we learned is that a lot of different kinds of organizations can be successful in enrolling older adults in SNAP. And that's really important because we know that older adults are isolated, they have trouble with transportation, and you need to be able to reach them where they are. It's not enough to sit in an office and say, well, they can come here if they want to enroll in SNAP. It's completely inadequate as an approach to outreach. So it's great to know that you can be an aging network organization. You can be focused on a particular ethnicity. You can be an anti-hunger advocate. You can be a food bank, a faith-based organization, a senior center, or a call center. And you can be successful in helping older adults in your community enroll in the most valuable nutrition program available to them today. Of course, there are strengths and challenges associated with each type of organization, and these are things that we learned through partnership with these grantees and the honesty and forthrightness they shared with us in talking about things that they were finding difficult and where they were really having a lot of success. So some things that are kind of standard across all organizations, and this is our something that we developed initially with our benefits enrollment centers, and now we've refined with some of these SNAP grantees, which is that one, there are really sort of 6 steps to getting an older adult into SNAP. And first is assessing your organization's strengths and challenges, and then the second is understanding your target population, or perhaps more appropriately, understanding your community. So one of the speakers earlier was talking about the Promotora model of outreach, these community health workers in South Texas. One of our grantees, Senior Community Outreach Services, is in that service area, and they use the Promotora model to successfully enroll older adults in SNAP. So that's a great example. Step 3, outreach and education about SNAP and seniors. You have to go and reach out in all corners of the community. One partner that we work with, Elder Law of Michigan, uses voter registration data to target likely eligible people in low-income areas, and they send them a birthday card before they turn 60, and then before they turn 65, and it says, get in touch with us. You might be eligible for help with your groceries. It's extremely effective and very simple. Step 4, screen clients for benefits eligibility. We've got a great tool called Benefits Checkup. This is the address for the SNAP-specific portal. It's about 12 questions, and it tells you whether you're likely eligible for SNAP. And it also tells you what other benefits you might be eligible for as well, some of those federal programs that I talked about earlier. And then there's step 5, which is also more accurately sort of steps 5 through infinity, which is the hand-holding process of working as senior through the process of applying for SNAP. Because I think there's no retirement fantasy so strong as the one of doing endless paperwork every 6 months to get money to buy food. So that is something that is ongoing, including this following up to troubleshoot, ensuring that they know how to use their EBT card. My grandmother never used a credit card in her life. She wrote checks for everything. If you handed her an EBT card, she would be like, honey, you're gonna have to show me how to use this. And so we actually have a partner that has a point of sale dummy machine, and they show people how to swipe it and what it's gonna look like. You know, it's walking people through those things that might be confusing, and reminding them about recertifications. Now, in a lot of places, you've gotta do interim reports every 6 months. Your little postcard in the mail has your income changed. So many seniors are on fixed incomes. Their income never changes. There's no reason why they should have to do that paperwork. So in some states, they make it easier. And I think Catherine's going to talk a little bit about some of those programs later. And then some of the things that we found that seem kind of obvious, but I think are worth pointing out. So we had partners who would screen a client over the phone, say, you're eligible, we're going to send you a SNAP application, and they would never hear back from them. But if they filled that SNAP application out during the process of that phone interview and sent it to them to sign, they got an amazingly higher return rate. It's kind of common sense, but it gets to some of these getting people triggering better behaviors and responses. Now, in the course of all of this, all of our partners have to deal with overcoming stigma. We talk about stigma in DC and how to change the national conversation, but the conversations that really matter are the ones that are happening between 2 people at a desk or over the phone, and it's a benefits counselor and it's a person who isn't sure if they want to apply for SNAP. They hear things like, other people are worse off than me, I was always taught you live off what you have, I don't need that, it's too much work for too little money. Some of the things that our partners use in terms of their messaging to overcome that stigma is to say things like, you pay taxes your whole life, those taxes fund SNAP, like Social Security, you're just claiming what you earned. Extremely powerful. Even if it's just $15 a month, that can help you afford your prescriptions. So it's reframing SNAP as a medical benefit. And finally, particularly in rural areas, saying that it's through USDA, not Health and Human Services, so it helps local farmers and business. It's been really effective, and I think it's pretty clever. Another thing that all of them have been learning and doing is developing partnerships in order to make this challenging grant effective. So things like building a relationship with your state agency or your local office. Again, where that's possible, it makes it so much easier to improve your outreach and to resolve issues effectively. It can help you draw down federal dollars to supplement your outreach. And too few state offices look to aging services organizations for help in reaching out to this underserved population. It makes no sense to me, and I think we need to encourage that through policy. Other community-based organizations, our partners here in DC, DC Hunger Solutions, partner with an earned income tax credit campaign. They train those tax preparers to identify people who might be eligible for SNAP, and then they follow up with them. And then partnering with CSFP distributors. For example, our partner in Philadelphia, Benefits Data Trust, works with their local CSFP program, Fill Abundance. They just put a flyer in there, in that box of food, and they got a great response, and it's been one of the effective approaches for them. The second item, and I'm moving really fast because I'm splitting some time with Catherine here, social media outreach. So sometimes I say social media outreach at the National Council, I work at the National Council on Aging, we're working on social media outreach, and I hear, seniors don't go on the internet. That's not true anymore. 3 in 5 seniors, 65 plus, are online right now. 71% of them go online every day or almost every day, and about half of them are on social networking sites like Facebook. Seniors are the fastest growing social media adopters in the US. If anybody in here is Facebook friends with their in-laws, you can attest to that fact. So this is something, so reaching folks through social media like Facebook So many seniors are isolated, they have issues with mobility. Some of them, you can reach them online. In year one of the SNAP initiative, we had significant success in driving older adults and their caregivers to SNAP applications online by using digital marketing tactics. So what we learned from using Facebook, it's the most popular social networking site among seniors. It's easy to use, which is why so many of them use it. It is inexpensive to reach a lot of people. In our experience, you could start out by paying $20 on a Facebook ad or promoted post, and you can reach thousands of people. There's really no comparison on a cost analysis. It has powerful targeting features, so you can target a specific income bracket, and it gets results quickly. On a daily basis, you can look at what's performing and adjust accordingly. So what happened in year one? So low income is kind of a weird term for Facebook because their lowest income bracket that you can target is $100,000 in household assets. So we just sort of gritted our teeth and clicked that. We reached over 800,000 people. We had over 100,000 people click to SNAP applications through ads like this. And actually, in the course of this presentation, you will see 99% of the easily available stock photos of older adults and food that aren't completely patronizing. So if I were to make a recommendation about how we can increase the visibility of senior hunger, simply making available better stock images, it would be a huge step. We saw it with Sheryl Sandberg in the Lean In work, where she partnered with Getty Images, and now they have all these stock photos of, instead of the working mom who's frazzled and like juggling a baby and a laptop, it's like very empowering images, and it's made a really big difference in how that looks. And it may, it's one of those things that may seem trivial, but I think it's very important. During the year one, 30% of our SNAP application downloads came through Facebook. And over the course of this multi-year initiative, we've helped more than 500,000 seniors and caregivers find the SNAP applications for their state through social media. So public policy, a lot of what we've been doing focuses at the state level because SNAP is administered at the state level. Some things that we see as being extremely effective are things like the Elderly Simplified Application Project. Alabama is actually the best example of how to do this. And I know Catherine's going to speak more to this, so I'll just kind of go to the next one, which is the standard medical expense deduction. Seniors and people with disabilities who are applying for SNAP can deduct their out-of-pocket medical expenses after a $35 disregard. Something that's unique to those age groups. They can do it, it increases the value of their benefit, but it's really time intensive because they have to itemize all those. With a standard medical expense deduction, after $35, they just get a standard deduction, and it saves paperwork for the senior and it saves paperwork for the state. It's very efficient and with no decrease in accuracy for the state agency. And then partnering with aging organizations and state SNAP outreach plans. These are formal plans with USDA that help draw down a 50% match in federal dollars using private or state dollars. In Alabama, we've been working with our partners there, and the state aging commissioner has dedicated $100,000 of state funds this year to draw down that federal match. So at the federal level, we support policies that are going to simplify this process for seniors. There are things, we're great at reaching people with Social Security, we're great at reaching people with Medicare. Why can't we be great at reaching older adults and getting them into SNAP because they're eligible and they're missing out, and it's having serious negative consequences for them personally and for us societally. So I've just skimmed over a lot of stuff that's available in our best practices handbook. It's available at this URL. I also have about 25 copies in my bag if anybody wants one. And with that, I cede the rest of my time to Catherine Law of USDA Food Nutrition Service.